Welcome everyone to the latest webinar with Cosmetic Laser Dermatology. I'm very excited to be here today with Dr. Douglas Wu, and he is going to be presenting our brand new exclusive proprietary treatment called the TotalTat3, which is our unique combination treatment for total tattoo removal. The presentation will be about 20 minutes long, and then we have time for question and answer, and the whole thing is being recorded. So we encourage you to share this with family or friends or anyone that you feel might benefit from the content. And as a reminder, at Cosmetic Laser Dermatology, we do have 7 board certified dermatologists. All of them do offer laser tattoo removal. But today, Dr. Wu is the expert who is coming to us to speak on the topic. Dr. Wu is a board certified dermatologist and he has his PhD. He originally hails from Canada, which might be why all his patients love him so much because he's so nice. And he is definitely incredibly talented, not only with lasers of all sorts, but with injectables, body sculpting, veins, and all things anti-aging and cosmetic dermatology. So you're definitely in great hands. And without further ado, Dr. Wu, the floor is yours.
Thanks, Risa. Those are very kind words. And thanks for joining, guys. My name is Dr. Wu, and we'll talk a little bit about tattoo removal today, and specifically a novel way that we've developed to sort of maximize the safety and effectiveness of our tattoo removal procedures. So let's kind of dive right in. Tattoo regret is actually pretty common. When you type this into Google, this is like a famous image. It just comes up. It's quite comical. But to be honest, there's really no shame in regretting or wishing that a tattoo be removed, because in fact, some studies have shown that 75% of people with tattoos eventually regret at least one of their tattoos. Okay, and there are many common reasons for this to be the case. Maybe we were too young when we got it, or it's no longer as meaningful as it once was. It doesn't currently fit our lifestyle, or it's become a professional hindrance potentially. Names are one of the very most common things that we see. The names are no longer relevant or no longer appropriate in whatever way, and sometimes the tattoo is just poorly done, and it needs to be removed. And so there are a wide range of common reasons and fully acceptable reasons. So it's not necessarily a bad thing, truly. A tattoo has run its course and it's time for it to be removed. And the good news is that with our latest technologies, we can actually do this in a very safe and effective way. And that's what this presentation is going to be about. So laser treatment is essentially the best way to remove unwanted tattoos. Whatever else is sort of suggested for tattoo removal, there's really nothing that is better than laser. And I'm going to go very briefly into how laser accomplishes this task so that we have a better understanding of the treatment itself and what we can expect. So basically, what is a tattoo? Well, if we look at it under the microscope, tattoos are composed of these very large ink particles that are embedded into the skin. And so they could be any color, like black, red, blue, green, yellow, etc. But the key fact here is that they're embedded into the skin as very large particles. Okay, and therefore, because they're so large, they are resistant to natural removal processes. Our skin actually has these cells that sort of circulate in the skin, and they usually gobble up whatever should not be there and take them away from our skin. Tattoo ink, because it's so large, the macrophages, that's what these cells are called, they try to gobble them up, but they're just too big. And so they cannot be removed, and this process is stopped. And therefore, tattoos are essentially permanent, okay? Where laser comes into play is that we can now have lasers that target specific tattoo ink colors, okay, very, very specifically, and deliver energy into these fragments and basically destroy them, okay? They bust them up into these tiny little grains and reduce their size, okay, as depicted in this little cartoon. And after these large tattoo particles are fragmented and shattered into tiny little particles, then it becomes much, much easier actually for the macrophages to come in and just gobble them up. And so a bunch of macrophages come in and essentially gobble up these remnants of tattoo ink and naturally remove them from the skin. Okay, and that essentially is how tattoo removal is accomplished. And that cartoon hopefully sort of illustrates the basic principles. If we look a little bit closer under just regular light microscopy, you can see on this side here, these are those black dots embedded in the skin. Those are the tattoo ink in real life. And that's how they look like under the microscope. And whereas after laser, you can see that they're just shredded. They're dust, basically. And that makes them much easier to remove. And then even going one step further with these really powerful, what we call electron microscopes, these things can see like the tiniest things on Earth. And the black ink, it looks like these clumps of just, aggregates of material, but after laser, it's essentially dust. They've completely vanished. And the red ink, it's a grayscale, so it still looks black and white, but they're large shards of ink essentially sitting around. But after laser, again, they've been converted into dust and therefore are much easier to remove. So that's basically how laser tattoo removal works. But it turns out that only very specialized lasers can achieve this effect. Okay, the vast majority of lasers just don't have the ability to shatter tattoo ink. And so we have to rely on very specialized lasers. And it turns out over the last 5 to 10 years or so, a new generation of lasers has been invented, the so-called picosecond lasers. And these have been shown to be essentially the most effective tattoo removal lasers that we currently have. In fact, picosecond lasers, the reason why they're called picosecond lasers is because they fire a laser beam within 1/1,000,000th of a second. This is extremely, extremely fast. Okay? And it turns out that the faster your laser, the better it is at just breaking up ink and removing tattoos. And myself and Dr. Goldman and a couple of our colleagues, we actually sort of reviewed the worldwide scientific literature over the last 50 years on this topic. And we can really conclusively say that these lasers are almost always better and the best, in fact, to remove tattoo ink. However, there's actually several of these picosecond lasers available in the US and in the world. And each of them actually, although they use the same basic technology, the so-called picosecond technology, they each have a little bit of differences and pros and cons. So they can target different parts of the tattoo removal process with varying degrees of effectiveness. And so we actually at our clinic have 3 of the best models at our clinic. And we can therefore combine different laser technologies into a single treatment and leverage all of the strengths of the individual lasers while minimizing or masking or at least compensating for any of their weaknesses. And this is the technique that we have termed so-called TotalTat3. Okay, it's a total tattoo solution, and the 3 denotes essentially the number of lasers that is commonly combined. In fact, that's not necessarily set in stone. We can use anywhere from 1 to 2 to up to 5 or 6 even lasers all at the same time, depending on what the tattoo looks like, depending on what we're trying to do. And that is something that we customize with every treatment. But essentially, a combination of lasers is almost always used in order to get the safest and most effective and the fastest treatment. Because ultimately, tattoo removal is very, very effective and it's very reliable. The only real barrier to tattoo removal is that they're stubborn. And so we are always trying to find ways to make our treatments faster. Okay, the less number of treatments that you have to undergo to get rid of your tattoo, the better. And that will save time and cost and all this kind of stuff. But in the past, before the picosecond lasers and before TotalTat3, it was not uncommon to have 10, 15, 20 treatment sessions to remove a tattoo. But nowadays, as I'll show you, a far smaller number is usually required. So what is TotalTat3? Well, let's go back to our little cartoon. We have these large clumps of ink. What TotalTat3 is combining different lasers all at the same time. So for example, one of these lasers, the pico way, okay, it hits the tattoo ink and just destroys it, okay? And that's often where 99% of clinics stop, because this will lead to some effective treatment. Because the tattoo ink has been broken, and as shown previously, this will be eventually removed. However, we've found that when we then subsequently use another picosecond laser, like for example, the PicoSure, both of which we have, then we can actually reduce these particles even further, okay, and target even different colors in different ways. And then finally, using what's called a fractional CO2 laser, okay, which essentially pokes little holes and creates tiny little microscopic channels in the skin, we can then further improve the removal effect, because we have the normal effect with our macrophages coming in and gobbling up these shattered tattoo fragments, but we can also rely on these fragments being eliminated from the surface of the skin now that these channels have been created by the CO2 laser. And so this triple combination is a common sort of thing that we do in our clinic. And we've shown that this really helps to speed up the tattoo removal process while not increasing the downtime, not increasing the risk, not increasing anything in terms of adverse side effects, just improving the effectiveness of the treatment. And so that results usually in essentially complete tattoo removal. Best of all, the procedure is painless. And this is, something that I really would like to emphasize. Tattoo removal in general can be very, very painful, but we meticulously numb every single tattoo with lidocaine before any laser treatment. And we have dedicated nurses who are trained in this numbing technique. Basically, it's applied very precisely, very carefully, and very meticulously in order to fully, at least as much as possible, anesthetize the entire area so that hopefully the procedure itself is completely painless. Many clinics, and even I have very rarely, at the request of certain patients, use just topical numbing cream, for example, to try and reduce pain from the treatment. But this turns out to be largely ineffective. The topical numbing is just not quite powerful enough. But when we actually use the lidocaine in a very precise way, then we can numb this whole area and you don't feel a thing. So let's kind of go into a little bit of some examples here. So this was a fellow who came to me, he had this tattoo on his arm for many, many years, and this large Viking sort of tight tattoo of some sort. And it's very heavy black ink, and these tend to be, at least in the past, they were very resistant to treatment because the black ink was obviously placed very heavily and usually placed very deeply into the skin. And so in the past, this could be a challenge, but with the TotalTat3 system, with 4 treatments, we can essentially achieve virtually like 100% removal. And in 4 or 5, or, I usually say something like 3 to 8 treatments is the norm. This is not something that was usually the case before with our previous technologies and our previous techniques. Similarly, this fellow here had a tattoo on his chest that had run its course. He didn't really want it anymore. And once again, with 4 treatments, you can see how it's almost completely, entirely removed. And you can barely see any evidence of it anymore. And all of this happens in a very safe way. The recovery time after tattoo removal tends to take maybe about a week or so. The skin is kind of crusty and peeling and flaky and stuff, but it's not painful. And it's pretty easy to take care of. You just keep it clean and put a little bit of ointment on there, and it very reliably and consistently heals, and the skin is totally fine afterwards. This particular tattoo, not really any major problem with it, but it's just in a location, that is essentially impossible to hide. And so this raises issues in terms of sometimes employment and stuff like that. If your employer, or many of my patients come to me because they have tattoos on their wrists or on their neck, or ear, face, etc., places that you can't cover with clothing, and their employer requires them to have these tattoos covered. And so their only option really is to remove. But with TotalTat3, after a relatively small number of treatments, most of these tattoos can be largely removed. And many employers actually, will be sometimes a little lenient, as long as they see that you're in the process of the removal, then sometimes that can be acceptable as well. Multicolored tattoos can be treated here. And this was actually a very old case of ours where we had to target the blues and the reds and the blacks and stuff. But again, with this combination of laser treatments, most of the ink has been removed. Again, multi-colored tattoos, the greens, the yellows, the reds. All of these colors actually were very, very challenging once upon a time to remove. But with the newer generation of picosecond lasers in combination with the CO2 and the whole combination of lasers that we use in our clinic, these can now be fairly reasonably treated. This was 4 treatments. It's not quite there yet, honestly. Every image I show is a very realistic case, and these are all achievable results. I would say, in my opinion, maybe 1 or 2 more treatments will be sufficient. Probably just 1, honestly, will be sufficient to completely remove the residual in this tattoo. And some of my patients will come to me and proceed along a certain path, get to a certain result, and then just be satisfied with that and move on. Whereas some, really want to go to the very final end and remove every last scrap of ink possible. So that's a personal decision, and respect everybody on their own personal journey for that. One area that I found really, really good with our current techniques and technologies is these really delicate areas. I get a lot of patients come in with cosmetic tattoos, so eyeliners, eyebrows, lips, etc. That in the past, these were really quite difficult to treat because the eyelid margin is a very delicate area for obvious reasons. Our eye is there, for example, but it's also very thin skin and very delicate skin. And so this is the last area that you want to do like 10 or 15 laser treatments on, because it can cause micro scarring in the area that can cause problems. But with our new technique and our new technologies, we can really remove these in a nice way. And in general, it takes, in my experience, somewhere in the range of like 2 to 3 treatments, maybe 4, and often that's all that is required. We place very special precautions to protect the eye during these treatments, and we have to use the laser in a very precise way to target the pigment and preserve all of the surrounding tissue. But if we do this correctly, it's a very gratifying treatment. And this was a Caucasian patient, and so there was less concern with laser. But this was an Asian patient, and again, 2 or 3 treatments later, you can see that the eyeliner is almost fully removed, and she was very pleased. And there's really no change or damage or any appreciable difference in the skin quality after laser removal. This patient stands out to me because she came to me truly distraught, after she had this cosmetic tattoo applied, for obvious reasons. There were unfortunately some mistakes made, and the eyeliner tattoo migrated to areas that it was not supposed to be. And she kind of toughed it out for a couple months, hoping that it will get better. And she was told that, yeah, it'll fade, it'll get better. But unfortunately, it never faded. And tattoos are essentially permanent. So these are not likely going to fade without treatment. But I call attention to this case because in the past, with darker skin tone, and especially in these under eye areas, very delicate skin, it's very difficult to approach this with laser, previous laser technologies. But with our current techniques and our current technologies, especially with the picosecond lasers, we're able to, achieve a pretty reasonable result. And this one, I think, took maybe 4 or 5 treatments, so a little bit more treatments to get. But her eyeliner, which she wanted to preserve, that is fully preserved. But all of the extra, all of the diffusion and the spread and all of that stuff has been essentially completely erased, and there's absolutely no evidence of anything at all. And the skin is perfectly normal after laser treatment. So that's essentially TotalTat3. And, it's a laser tattoo removal has been around for a long time. I've been using it for decades. In fact, the senior medical director of our clinic, Dr. Mitch Goldman, was one of the pioneers of this technique. And he has published, hundreds of times on this kind of thing. But we now know that with the combination of lasers that we have at our disposal, something like TotalTat3 is truly the safest and most effective way to treat unwanted tattoos. It combines multiple different laser technologies in the same treatment session. Okay, and so you don't have to come in multiple times for different lasers. We do them all at the same time in a very safe way. And even more lasers, in fact, can be combined for special cases when and if necessary. At our clinic, we have, I think, over 40 different lasers or something like that. And so there's really no tattoo or even pigmentary issue that we cannot remove. And this extends even to, sometimes people get injured, you scrape your skin against the asphalt or something, and little particles get embedded in the skin, what we call an asphalt tattoo. And these lasers can even remove that kind of scar very, very nicely, or pencil leads, or any sort of trauma that embeds any sort of pigment into the skin. It can be removed with this technique. So it's truly a unique and exclusive treatment. One of my favorites, one of my specialties. All of us here at the clinic do this type of treatment, and we're very, very comfortable to sort of handle this type of issue. So that's TotalTat3. Hope that was of some interest to you guys. Thanks for tuning in. Be happy to sort of answer any questions if there are any.
Great. Thank you so much, Dr. Wu. It's really impressive to see the before and after photos, and I'm happy, that you clarified what's realistic and what's not, so that people really know what they're getting into. And you definitely addressed the pain question, which I think may have avoided a lot of questions. So, but there are still some coming in. So if anyone else has questions right now, please use the Q&A feature in Zoom so we can try and get as many of them answered as possible. All right, so first up, is this treatment okay for if you have keloid prone skin?
That's a very good question. And yes, the answer is absolutely yes. We would take that into account, of course, and adjust our laser settings and proceed with caution. But I've treated many patients who have keloid-prone skin. We even have active keloids, and this treatment, if done correctly, is very safe.
Got it. So here's another question. I have undergone previous laser tattoo removal sessions, and I'm not happy with the removal. Can you use this new technology even after I've had some prior attempts to remove at a different clinic?
Yeah, that's actually a very common scenario that we face. And the whole reason why we designed this treatment, one of the reasons anyways, was to improve upon that situation where, you've had many treatments before of a different technology or of a different technique, and you kind of hit a wall. It's just not progressing further. This solution will definitely progress you further. I'm not sure if I encountered a single tattoo that has not responded to this treatment before, and I've treated thousands of tattoos. And so I'm quite confident. I mean, everything will obviously depend on the consultation. So come in and we'll have a look, but really quite confident that we can help you out with that.
Great. All right. So can you tell a little bit more about, does this work with scars, and how about old scars?
Yeah, so scars, two things. So there's scars that are not in a tattoo, and then there are scars that are in a tattoo. Scar treatment itself is approached in a slightly different way. Okay, and we have all of the technique and technology to do that. And in fact, maybe we could do a webinar on that at some point. There's a lot of different types of treatments that we offer for scars in general. If a tattoo itself, because of previous treatment or whatnot, has scarred, then this TotalTat3 treatment can still be applied to the residual ink, but we would also apply additional treatment to the scarred areas to improve those at the same time. So they can all be done actually at the same time. And I have encountered cases where I've done that.
Great. All right. Oh, this is a really good question. How long should I wait between sessions?
Yeah, so the fastest that we can do is 1 month in between sessions. And the reason for that is if you recall from that cartoon, the body has to come in and kind of gobble up this ink and take it away. That process takes about 1 month to complete. In fact, Dr. Goldman was the one who sort of studied that once upon a time. So 1 month is the fastest that we can do it. But, if you wanted to wait even longer than that, there's no harm, really. You could do it every 2 months, every 3 months if you wanted to, but 1 month is the minimum.
Got it. Okay. Are there any long-term effects on the skin after doing the laser tattoo removal?
So that's a very good question. And the answer is a little bit more nuanced. So we always try to balance between speed of removing the tattoo, which means kind of using powerful settings, versus preserving the underlying skin, okay? And so this is a little bit of a personal choice. Some people want it just to be as fast as possible to be removed, and they're okay with maybe a little bit of a slight ghost image behind or something like that, as long as the tattoo is removed quickly, okay? Whereas other individuals want absolutely no possible sort of, or minimal anyways, detection of skin change. And that can be done. It just may require more treatments because we go more gently. So all of that is customizable. And it really, that's why, experience really matters when we're treating tattoos. And we have to be in constant communication during the process. So we're meeting your goals. But the short answer is yes, the skin can be completely preserved. And it's a factor of how we use the lasers.
Got it. So for when permanent makeup is done, the cosmetic tattoos on the eyelids, is the eye area numbed when removing?
So we numb the eye only in that we put in a little eye shield. Okay, we put in a little metal contact lens to protect the eye. Okay, and prior to inserting that lens, of course, we have to numb the eye a little bit. But the skin itself, yes, we still apply a very precise injection of lidocaine directly to the skin so you don't feel anything. And that's critical, of course, for the eye, because the last thing you want to do is be jerking around while the laser is firing in that area, because it's very sensitive. So we completely numb it. And honestly, it's very gentle. You don't feel a thing.
Got it. Okay, great. And I think this permanent makeup tattoo removal is a very big area. We've been getting a lot of inquiries about it lately and treating a lot of patients because so many clinics won't go that close to the eyelids, for example. So could you maybe speak a little bit more about, how about the microblading on the eyebrows and lip blushing and other, I know you didn't show pictures of all of those, but I know we've done them. So
we've done lots of them. Yeah. And the eyebrow area is an increasingly common area that I treat. And the number one question I get is, is the hair preserved? And the answer is yes, as long as you do it correctly. And then number two is, how many treatments does it take? Usually, if there's no complications, it's also pretty quick, 3 to 5 treatments, something like that. But the major concern with eyebrows and lips is that these inks have a slightly higher risk of what we call paradoxical darkening. This is something that, if you suffer from this problem, we can talk about it more in consultation. But basically, what happens is that after laser, the tattoo darkens instead of lightens, which is the exact opposite of what we want. And this is more prone to happen in the eyebrows and in the lip. But the interesting thing is that with TotalTat3, we can actually remove that paradoxical darkening in a much faster way than we used to be able to do so. And in fact, before, it almost was permanent. And so it was a horrible sort of complication. But now with these newer lasers and newer techniques, we can actually just treat straight through that and continue to remove. So it removes a big barrier actually to treatment. And so I treat eyebrows and lips and eyeliners all the time now.
Great. Okay. Let's see. Do colorful tattoos generally take more treatments than a black and white tattoo?
Sometimes. It depends on the color. Yellows can be a little bit, yellows and oranges can be a little bit more resistant. But honestly, what really determines how long it takes to remove a tattoo is the amount of ink that was placed to begin with and the depth of the ink that was placed. And so the color with the newer lasers is not as big of a factor anymore. With the old lasers, yeah, blues and greens were almost impossible to remove, and reds sometimes were very difficult to remove as well. But now with the TotalTat3 and the new lasers that we use in this combination, we can treat every single color with pretty good effectiveness.
Got it. And how about some of the tattoo pigments that are being marketed these days is that they're like removable?
Interesting. I'm not very familiar with those. If they are temporary tattoos, then they can fade with time. That is fine. But even these temporary or slow fading tattoos can be treated actually with laser and removed even quicker. So the same principles apply to these situations.
Okay. And with what you've seen in your experience with the permanent makeup removals and some of the complications, do you generally advise that it's not something ideal to consider?
So it depends, if every tattoo is a little bit different. So there's a certain look that, may gives me suspicion that this is a tattoo that won't respond very well. And so that's a discussion that we have to have. Because if it darkens, then obviously it's not going to be what you want. But even if it does darken, I'm pretty sure that eventually we can remove it. it just may prolong the journey a little bit. And so that's something that we have to come to terms with. And it's a decision that we make together. Sometimes I'll do a test spot first in cases that are high risk, just so that, the whole thing doesn't darken. Maybe just a little test spot darkens, and that's a little bit better than the whole thing, darkening. So there are many ways to approach that kind of situation.
Got it. Because I know I probably speak for some more of the women on here that having makeup permanently on my face certainly sounds very efficient for my life. But after seeing all the before and afters, it seems probably not worth the couple minutes of time saving. All right. How long does it take to heal for a smaller tattoo?
So small tattoos can sometimes heal up in a few days, honestly. And I usually say about a week in general for most tattoos. That's just the initial healing phase. And it may be a little bit longer for the first few treatments because there's more ink, and it may be a little bit shorter for the subsequent treatments because there's less ink. But in general, about a week or so.
And do you keep the tattoo fully covered while it's healing?
Not usually, to be honest, just some bland ointment, keep it clean, and it's fine.
Okay, so this treatment can be done now in the summertime.
Absolutely.
Anytime.
We treat all year round.
Got it. Great. All right. The big ticket question is there a range or any cost information that you can share?
It really depends on the size and the complexity of the tattoo. Tattoos are so varied and so intricate these days that really does come down to that. I would say the range of prices ballpark can be, anywhere from $150 up to even $750 or more per treatment, okay, for really, really large ones. So that's probably a general range, but it is done per treatment, and that's why, reducing the number of treatments is really our goal, so that saves everyone time and money in the end.
And there are many other clinics out there that advertise much lower rates, but then sometimes they'll need 15 plus treatments to accomplish the same goals. Is that?
That's what we find, yeah. And so everyone's got to come to their own, comfort zone in terms of cost, and we always try to be very cost conscious. But we do know that we're offering a very valuable treatment here because it will reduce the number of treatments total that are required to remove the tattoo.
Of course, and the potential complications, because we do have a lot of people coming to us after going elsewhere, less expensive, part way through, and then they come to us to kind of fix it.
That's the issue, even with perfect treatment, after 10 or 15, 20 laser exposures, there's no way that the skin will change. It's just unavoidable, even with perfect treatment. And so you really want to be cautious about that as well.
Got it. So that makes sense. Let me just, so, all right. I want to move your screen share here. All right. So do we offer payment plans?
I think we do. We have something called care credit.
Mm-hmm.
My medical assistants kind of take care of that end of the deal for me. So, but I think that's what we use here.
Yep. Yes. So we do. Yes, we do. And all right, let's see. Oh, here's another good question. What type of laser can be used when the tattoo is raised?
So a raised tattoo, if it's not truly scarred, okay, will still respond to the TotalTat3. It just might be a little bit slower to respond because there's some micro scarring. That's what the raised sort of texture implies. However, if it's actually scar, so like lumpy, bumpy, and true scar, then that's where we're going to apply actually our scar revision lasers in combination with the TotalTat2, and even some injection treatment can be worthwhile too. So there's many ways to approach that.
Got it. Okay, great. And let's see, any final questions from anyone or any final advice from you, Dr. Wu?
No, it was my pleasure to be.
I know you already said everything in the presentation. I guess before we get to our giveaway, what I will say is I definitely encourage all of you to really consider who you're letting do your tattoo removal, your injectables, your lasers, anything, because although some places might be less expensive, in the long run, oftentimes it can be more expensive to fix mistakes that can happen. And, we always say, really trust your face and your skin to the experts, and that with a lot of these treatments, it's generally, I'm all for saving a buck or two, but generally these types of treatments are not the best options a lot of times to try and get the lowest cost. So with that in mind, if everyone in the chat right now could enter in the best way to contact you, your email or phone number for the giveaway, you can do it privately. So to the host and panelist, so that we can determine a winner. We will get back to the winner tomorrow to notify them. So if you all could now start popping that information in, that would be great. And otherwise, I really encourage you to come in and schedule an appointment with Dr. Wu or with any of our board certified dermatologists, whether it be for tattoo removal or any other laser treatment. I'm getting ready. We're almost going to share my own personal video diary. Dr. Wu did a Fraxel duel on me 2 weeks ago. I don't know if you could tell, my skin's looking fabulous. So there's just so many amazing treatments we can offer. So I do encourage you all to come visit us. To do it privately, you need to do it in the chat feature, not the Q&A feature. One person is asking. And otherwise, we should have most of your information as well if you registered. We will be sending out the recording from this lecture this weekend, and I really do encourage you to forward it to anyone, even if they're not local, it's okay, anywhere in the country that has tattoos or is considering tattoo removal, because doing it safely is the most important goal. So thank you so much, Dr. Wu, for your time today. Thank you to everyone that joined in the middle of your workday or the middle of your busy days. We really appreciate your time, and we really appreciate you, Dr. Wu, for sharing all this expertise and those very impressive before and after photos.
My pleasure. Thank you very much.
Thank you all, and we'll notify the winner tomorrow, and the rest of you, we hope to see you soon. Bye.
Bye.